Childhood cancer is a significant public health challenge in Nigeria, with an estimated 7,000 to 8,000 new cases annually. Pediatric oncologists highlight the common cancers as leukemias, lymphomas, and retinoblastoma, often diagnosed at advanced stages. Recent advancements in treatment have improved, but challenges like drug shortages, limited diagnostic facilities, and a lack of trained personnel persists. The financial burden on families is overwhelming, with many unable to afford basic treatments. Support for families and survivors is improving, but long-term follow-up care remains a gap. Advocates emphasize the urgent need for action, stressing that investing in childhood cancer care is investing in Nigeria's future. Korede Akindele, Director of Programs, the Doctors Cancer Foundation and board member of the International Society of Pediatric Oncology, joins us now for a chat on this. Thank you for joining us.
Thank you for having me.
Now, these numbers are really disturbing. 7,000 to 8,000 cases yearly. How bad is the situation?
I mean, like you said, I don't want to use the word bad, but it's a growing concern that everybody, has to pay more attention to. And childhood cancer is just like every illness of a child that needs more attention. So it's growing in the country. I mean, globally, over 400,000 cases every year globally. And bulk of it comes from low and middle income countries, which Nigeria is all about. And one of the key issues are the reporting is not even accurate because we are underreporting it in Nigeria.
Wow. As
a result of different factors. People don't come out and report it. And even if you look at the registry base that we work in Nigeria are still hospital based. So some of these figures that comes into the hospital still stays with these hospitals. So Nigeria are just on the track to have a population-based cancer registry that tackles childhood cancer in Nigeria so that we can have an accurate figure. But the reality is there. It's a growing concern. And
all right, Korede, despite the prevalence rate you just discussed with us, so recent advancement in treatment of childhood cancer. Let's talk about the survival rate and quality of life of young patients in Nigeria. What are your thoughts on that?
Okay, for Nigerian, I would say the narration is getting different. It's not like 10 years, 7 years ago where we talk about the problem. For example, we have more professionals. Not that we have, there are just like 70 working in pediatric oncologists in Nigeria. But the attention and the development of knowledge in childhood cancer in Nigeria is growing. Before we have dedicated centers for in Lagos, for example, that deals with childhood cancer. We have trainings that our pediatric oncologists are having access to. So it's helping the improvement. For example, a type of cancer, that Wilms tumor, kidney cancer, the survival rate in the country is over 50% now. Unlike before, it goes. And so the growing number of awareness, of advocacy, so it's making, so the treatment is advancing, but the pace is not what we want, but we can say we are not where we used to be before.
I see a report here talking about some advocates calling for, you talked about registry the other time, and also lack of data when it comes to reporting these cases, which is of course impeding, the treatment and achieving success with reducing the prevalence of this particular, cancer. But I'd like you to also talk to us more about some of the other challenges that we've listed, some like drug shortages and also the financial burden it is on the patient. Talk to us about other challenges that this poses.
Okay, one of the main challenge that we have is awareness and education, the type of society where we are has a lot of religious backing in our society here in the part of the world. And so when I talk about awareness and education is not just about the public alone, because the reality is no parent would want his or her child go through illness. So when a child is sick, they go to the hospital, they still take them. But the lack of knowledge at the primary healthcare level, it's one of the key issues that is facing childhood cancer in Nigeria, because it presents itself like every other illness that a child has. And so what we try as much as possible to do and to advocate for and to plead with primary healthcare workers, people working in private organizations, private hospitals that deals with children, that when you see a child concurrently with a kind of illness, you don't just sit down there and say, let's keep doing this, let's keep doing this. You must be able to do a referral easily and quickly if you are not getting solution to what you're treating in a child. And also, it's also important for parents to always seek for second opinion, which is so important in this. So awareness and education is one of the critical challenge. Yes, we talk about funding, facilities, and all those things, but there are things you can control. But the ones that you can control, what do? You try as much as possible and focus on it and bridge those gaps of education in the primary healthcare for early detection, education with the professional to be able to be in line with the current advancement of pediatric cancer treatment in the world.
All right, Korede, what would you regard as the most significant policy changes achieved through childhood advocacy efforts so far?
Okay, we talk about registry now. Yeah, it's one of the key things that we've achieved so far in our years of talking. I mean, I've been privileged to be on this track of advocacy going to over 7 years now, and pediatric cancer registry is one of the success, and also inclusion of pediatric cancer in the National Cancer Control Plan.
Sorry, are you saying there is a registry now?
We are working on the registry now.
Oh, okay.
Yeah, we're working with international partners on having a population-based registry where like a central place where everybody's sending their data, and it's on a very fast pace. I can confidently say that in the couple of months, definitely that will be settled.
Digital too?
Digital, yeah. It's going to be done with the National Institute of Cancer Treatment, NICRAT, and research. So it's a work that is going, and there is more attention to it, even with international partners like St. Jude. So it's a lot of works. Also, I mentioned inclusion of childhood cancer in the National Cancer Control Plan. It's one of the major breakthroughs that we are having. And also, having Nigeria win a bid to host the African Pediatric Cancer Congress, which is SIOP Africa in 2026. It's a laudable steps towards pediatric cancer care in Nigeria. We know what that will bring in into the country and bring in into. So all those little effort and the effort of advocacy, I mean, people get into be interested. I was just having a joke a few weeks ago. I say, okay, everybody interest is going towards childhood cancer now. So that little advocacy that we've done in the couple of years is
So at what point should a parent or caregiver, start panicking or call for action? Especially, you talked about the fact that some just keep managing a particular ailment in a child, and then they don't know when to raise the alarm that this may be childhood cancer. What are those symptoms to look out for and know that this is time to call for help? Okay,
first, let me just say there's no need to panic, and there's no need to live in fear.
Okay.
When it's something that happens, and it's not like adult cancer where you can say this is what was wrong. Yes, genetic, maybe like 20%, something went wrong. But for example, let's talk about the type of cancer called leukemia, which is cancer of the blood. And it presents itself most times like an infection. And so when you are treating such things repeatedly and something is not getting better in a child, you keep going to the hospital every now and then, you should know there's a problem with the child. So what you need to do is let the child see a pediatrician. That's where it starts from. It's not everybody that goes to a pediatrician. They go to the primary health care first, and when something is not happening, go to where you can see a pediatrician. When the pediatrician sees the child, he or she knows what the problem is. And when that is detected, they refer immediately to a pediatric oncology center where a pediatric oncologist can deal with it. So
that's the place of training, of course.
That's the place of training, and yeah, which is some of the things we worked on to close the gap.
All right, well, thank you so much, Korede Akindele.
Yeah. So awareness, engagement, referral, all part of a long line of processes to get in treatment, as it were. Korede Akindele, Director of Programs, the Dorcas Cancer Foundation, would like to thank you for your thoughts on this issue. Good to have you with us.